I'm going to tell the story of what it was like being a woman waiting in an ED waiting room with severe pain. For those of you who don't know, I am a junior doctor. I have worked hundreds of hours in an emergency room, so I know how it goes. I know the wait times, I know who they have to prioritize, so I understand the reason behind waiting. That doesn't mean how long I waited was okay. When I woke up on Thursday morning with back pain, I wasn't too concerned. I could still walk, and the pain wasn't too bad. I had had an L5-S1 microdiscectomy in 2022, which means that the disc at L5-S1 was bulging, pressing on the nerve root in the spinal cord, and was impacting my neurological function of my right leg. In English, I couldn't move my foot properly. Now, on Friday morning, the pain was starting to remind me of that previous episode. During the day, I started to get sciatica, shooting pain down my leg. The pain was now maybe like a 5 or a 6 out of 10, still manageable as long as I wasn't too active. Now, aside from doing some jogging in the past week, I have had no trauma. I hadn't fallen at climbing, so I didn't have a reason for why my back was sore. It got to 2 p.m. that day, and my pain had worsened to about a 7 out of 10, and I'd now noticed some weakness in my right foot. I went first to the physio and was quickly assessed. He agreed with me that due to the sensation changes and the change in motor function, at the end of the day, I was going to need an MRI spine. Seeing as it was now 3:30 p.m. on a Friday, my only option really was to go to hospital. Now, I've had some bad experiences at certain hospitals, so I decided to use my health insurance that I'm very fortunate to have and actually go to the private hospital. I was seen within 10 minutes by the triage nurse, who immediately told me that though they could help me manage my pain, they had no doctors that looked at spine, so really I was going to need to go to the tertiary centre. My pain was now a solid 8 out of 10, so I didn't have many options. My partner had been sick at home, so my only choice was to go by myself to the local tertiary centre in Newcastle and just wait in the waiting room. It was 5 p.m. on a Friday, and the waiting room was packed with about 42 people who were waiting to be seen and 107 people total in the whole department. It took an hour to go from the medical administration who took my name to then actually be triaged. At triage, I told them that my pain was an 8 out of 10 on movement. I had pins and needles in my right leg, I had shooting pain down my right leg, and I had weakness in dorsiflexion on my right foot. This means that I was having difficulty lifting my foot up. Now, the nurse offered me paracetamol, Nurofen, and 5 milligrams of endone. I tried to explain that I don't respond to endone because I don't actually metabolize it, and therefore it would not help my pain. So is there something else they could give me? This resulted in no response. I was told by the nurse that they would see me soon, put a cannula in, take some bloods, and the doctor would decide what scans to do. Nothing happened for 5 hours. I sat really still in the chair and I had my legs crossed underneath me. So by staying still, my pain was about a 4 or a 5 out of 10. So again, manageable. So I sat quietly and politely in the ED while I watched people with lacerations and ankle pain and patients loudly requesting to be seen, to be taken through the doors, and still my name was not called. I was told after 6 hours at 11 p.m. that my name was next to be seen in my section. Every time the door opened, I waited to hear my name. No one called it. After 7 hours, I hobbled to the nurse's desk twice to politely ask for more pain relief as the endone had not worked. Eventually, they gave me an intramuscular injection of ketorolac, which is an anti-inflammatory drug which can be used for muscular spasms in a person's back. This medication again, though, did nothing to help. I still sat there and I waited. I read my book, I tried to keep still, I watched the hours go by until it became morning. By 6 a.m, after 13 hours of waiting, I knew I would not see a doctor for another 2 hours. The night shift finishes at 8 a.m. and then the handover occurs, so the new day staff don't appear to see new patients until 8:15 a.m. So I just had to wait until 8:15 a.m, then surely I would be seen. My partner arrived at 7:30 a.m. with supplies and support. He again asked how much longer it would be till I would be seen, and they brightly told him that still, after another 6 hours, I was first on the list. I waited, we waited. I tried not to move. The pain continued. The wait to see a doctor ended up being 16 hours long. Finally, my name was called by a young male emergency registrar. It took a while for me to limp across the waiting room to get to where he was. I told my full history, I watched the expression change when I included my bipolar diagnosis, and I continued to explain my previous surgery and that I was still in a significant amount of pain. He did not address this. Now, I'm a person who hates to cry. It's not cathartic for me, it makes me feel weak, and I truly hate crying in front of other people. However, when the doctor started to examine me, he needed me to move my body and my legs. During any of this movement, I was sobbing. The pain was so bad in my back and going down my leg, I felt helpless, and still in all of this doctor did not take me seriously. Only when I reported altered sensation in my right foot, and the doctor could see I had weakness, that the doctor suggested I was probably going to need an MRI scan. 16 hours post this presentation to hospital. While I waited for the scan, the pain ongoing, I politely asked again for pain relief. The nurse went to ask the doctor and came back reporting that they could only offer me endone. I tried again to explain that the endone has no effect, but they still wouldn't give me anything else. It was another couple of hours before the scan, and this was when the neurosurgery resident came to say hello. She was young and female, and the first doctor to be remotely empathetic. She knew I was a doctor and spoke medically to me. She explained that her and the registrar would come speak to me as soon as the scan was done. I asked before she left if there was anything else they could give me for the pain. She seemed surprised that I hadn't had more and immediately went to get me morphine. I heard her ask the previous doctor if he minded if she gave me morphine, and he responded cavalierly with, "Oh yeah, if you want." Because clearly to that doctor, managing my pain wasn't any form of a priority to him. The morphine didn't eliminate the pain, but it was the first thing all night that helped. Thankfully, my MRI results were positive, as even though I had another acute disc bulge at L5-S1, it was not severe enough to require surgery. I was still offered an admission by the neurosurgery registrar to help manage my pain, but now, since I knew I didn't need surgery, all I wanted to do was go home and recover there. They started me on pregabalin, and hopefully this will help with the nerve pain. By the time I left the emergency room, I had been in the department for 22 hours. Now, why did I tell this story? I know what it's like working in an emergency department, as I said. I know that sometimes wait times are ridiculous, but can we please start taking female patients seriously who are in pain? Women who are quiet and don't complain, and are women in general, are 10 to 15% less likely to be given analgesia than their male patient. Women who are alone in an emergency waiting room without a male counterpart are less likely to be seen quickly. Maybe if I had shouted the department down, someone would have actually listened. I hate telling people I have bipolar because in a medical setting, people again see anyone who has a mental illness and are less likely to be given an appropriate analgesia, as there is an immediate judgment and bias. So if you work in a hospital, I understand the job. I see that this happens. Can we please get better at believing people's pain and start treating it properly? Thank you.